Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the elbow. It is the chair test, or the chair lift test, or the chair pickup test. And this test is one that is for diagnosing or looking for lateral epicondylitis or tennis elbow. It was first described in a paper by Dr. Richard Gardner back in 1970, and in this paper he was talking about several cases of the very severe lateral epicondylitis, and he was saying that this was a test that was utilized to confirm if someone had tennis elbow or lateral epicondylitis. To perform this test, you just need a chair, and I will say there are several different variations of how to perform this, and it kind of depends upon who you read. In the original paper, the only thing Dr. Gardner said was that the forearm was pronated and the person reaches down and grabs a chair, and there's a picture of a person holding a chair like this. Now, there's other papers that are more current that show that same thing, or somebody grabbing the handle of a chair, and I've even seen where somebody grabs like the back of a chair to try to pick it up. I think that really kind of depends upon the weight of the chair. And for the most common description of it is that the shoulder is adducted, the elbow is extended, and the forearm is pronated. And there is something about using more of the thumb, index, and middle finger with picking it up. So I believe that's probably more with lifting it from the back of the chair like this, but there's not like a universal way to perform this. So to perform it, just have them try to pick up a chair, and a positive is pain, and you can possibly probably vary it and see what you do. For the research for this test, there's actually not a lot out there. I could not find anything on the sensitivity, specificity, or anything along those lines. There was one paper that did talk about the reliability and the reproducibility of this test, but they were using a simulated or something similar, and it was going along with their system, and they didn't give a whole lot of description of the test in that paper. I will say there are a few interesting things about it. This test is very often referenced in papers when they talk about like provocation test for lateral epicondylitis. It's referenced very frequently. There is a paper that asked exit people how often that you use some of these tests, and it was like the lowest rated one. So like 70% of the respondents said that they use this test either like sometimes, rarely, or never. So at least has some recognition there. A very interesting one, it was in one about telemedicine, in the assessment of the elbow or the arm with telemedicine. And they said it was one of two tests that was utilized to look at the tendon, this one and Mosley's test. So I could really see with telemedicine, if you're trying to confirm if somebody has a lateral epicondylitis, this is possibly a good test to use, because most people are going to have a chair or something heavy just to tell them, hey, go grab, stand up, grab your chair, just do that. Tell me, what do you feel when you do that? So there you go. That is the chair test, the chair pickup test, the chair lift test. So what do you think about it? Do you utilize it? Have you ever heard of it? Do you think we possibly need to do some research about it? Let me know down in the comments. So, and like Mateo always says, take care of yourself, take care of your patients. We'll see you then.